Hello, this is Deborah Harper, President of Psych Journey, www.psychjourney.com. Welcome to the Psych Journey Book Club. Has your child been labeled with ADHD? Our guest, Dr. Lara Honos-Webb, believes that ADHD is a gift. She is the author of The Gift of ADHD, How to Transform Your Child's Problem into Strengths, published by New Harbinger, www.newharbinger.com. Dr. Honos-Webb will reveal the unique gifts of ADHD and show you how to become an advocate for your child. Dr. Honos is a licensed clinical psychologist in private practice in Walnut Creek, California. Her work has been featured in Newsweek, The Wall Street Journal, and Publishers Weekly, as well as newspapers across the country and local and national radio and television. She specializes in the treatment of ADHD and depression and the psychology of pregnancy and motherhood. She speaks regularly on her areas of expertise. She completed a 2-year postdoctoral research fellowship at the University of California, San Francisco, and was until recently an assistant professor teaching graduate students. She offers telephone therapy to residents anywhere in California. Visit her website, www.visionarysoul.com. Welcome, Lara.
Oh, good to be here, Deborah.
Well, could you start out for our listeners who are unfamiliar with the term? What is ADHD?
Well, it stands for Attention Deficit Hyperactivity Disorder.
Wow, what a mouthful.
Yeah, I'll break it down a little bit. I mean, in the old days, maybe it was what we called ants in the pants, but nowadays, one of the main symptoms is hyperactivity.
Mm-hmm.
And what does that mean? This is when we think of a kid that can't sit still, always bouncing up and down out of their seats, maybe always hitting a pen against the table. One of the other main symptoms is what they call inattention. It's the same thing as difficulty focusing. We may see these kids as kind of spacey, not being able to follow directions, not being able to follow through on projects. And then the other main symptom is impulse control problems. And what this means is they have a hard time, kind of thinking through the consequences of actions. They may feel an impulse to maybe hit someone that made them mad, and they can't say, that's not a good idea, I better, hold back. They tend to just kind of act impulsively. So that's the main symptoms that are used to make a diagnosis.
Well, that's interesting. Is there a certain age this occurs? Because what you just described sounds like most 2-, 3-, and 4-year-olds I know.
Well, that's an excellent point. Usually they make the diagnoses between the ages of 5 and 7, but it raises an interesting issue because between the ages of 2 and 5, they are increasing diagnosis and also increasing treatment with medication. And to my mind, it's a sort of a failure to consider the developmental appropriateness of these symptoms. And, and if you think about it, all of these symptoms imply performance demands in the sense that you're not following through and you're not paying attention to what you're supposed to be paying attention to. And so it really raises a question when you see diagnoses in these younger ages, what are the demands exactly that they're failing to live up to?
I think you make an excellent point. I remember when I was a child, none of us went to preschool, and we went to kindergarten. The expectation was, we cried to go home to our mothers. We wouldn't know our ABCs. We were at school to learn these things. And now it seems like those same expectations are expected of 3-year-olds. And by the time they go to kindergarten, they're supposed to have that block of knowledge and be performing at a level they didn't even consider where I went to school until late 1st or 2nd grade.
Well, that's exactly true, and I can tell you from personal experience, I'm in the thick of it. I have a 2-year-old, and I know I one time saw a 2-year-old reciting the full ABCs, and this was like a young 2-year-old, not even one that was almost 3, and I felt that sort of impulse towards, I'm doing something wrong, what's wrong with me? My 2-year-old doesn't do that. And, I do, remind myself that exactly what you're saying, that, by the time they're 5, they're all going to know their ABCs, and try not to get caught up in that. But, yes, that's the culture we live in today.
So the children, in my opinion, are very, very rushed. And you believe that has some impact on how we diagnose the kids or how they are diagnosed?
Well, let's keep in mind, for any diagnosis, and which is also true for this ADHD, you only make a diagnosis on one condition, and it's what we call an impairment in functioning.
Mm-hmm.
And so this usually entails some kind of demand for a level of functioning or some sort of performance. And with ADHD, the criteria are that it has to be an impairment in 2 or more settings. So even if you just saw the symptoms at school, you need to see them at home. And so especially in the ages between 2 or 5, it's hard to imagine, like, you imagine that between 2 and 5, they're just learning how to function.
Mm-hmm.
And so, with these increasing rates of diagnosis, I think it's a reflection of high levels of performance demands, right off the start, right from the beginning, even at these youngest ages.
So if I'm understanding what you're saying correctly, for example, brain function or developmental, how children develop has not changed. But say in the early 50s, when I was a child, the average environment would be you're at home with a caretaker, you get up when you feel like getting up, the day is fairly relaxed. The same child now, probably both parents work, they have to get up very early, they have to be rushed to daycare, they're in a structured environment all day, and then they come home to exhausted parents who have a lot of demands on them. And do you feel that change in environment and the change in expectations of what we expect of children is reflected in this increased diagnosis?
That's exactly right. Because that's why we would see an impairment in functioning, is if we had fairly high demands for attention and following directions in a way that I think is, as you're indicating, fairly new.
Mm-hmm. So what's interesting is you say that there are 5 gifts of ADHD. I'm really intrigued at what those are.
Well, the first one is creativity, and the same symptoms, and I guess I'm saying that in quotation marks, of, for example, spaciness. Usually what these children are doing when you ask them, where in the world are you? You seem spaced out. You hear that they're lost in their imagination, or they're thinking about something, maybe even thinking about on topic if it's in the classroom, but carrying it to a different new direction. And that same quality leads to creativity, thinking of things in a new way. In fact, even Einstein, when he talked about how he developed his wonderful theory of relativity, said that he had this imagination, this fantasy of riding on a wave of light and a beam of light. And that, if you think about that, that's a very intense imagination. And it was creative, and rather than impairing his function, it actually was directly responsible for his creativity and contribution.
What I find ironic about that is at the very high level thinking, in all the business magazines or management courses, the cliche is, well, you have to think out of the box. If you're going to retain any information, you have time to reflect and be creative. So if that isn't nurtured when children are very young, how can they be expected to perform at that, what is defined as the highest level of functioning, when they're adults?
That's a really good question, and I think it speaks to our educational system. And to kind of carry along with the rest of the gifts, another one that's sort of constrained by similar features is the exuberance. And, I mean, you, as an adult, how many of us want to come home on a Friday night after a full work week and maybe order a pizza and sit in front of the TV? And what a wonderful gift it would be to have exuberance, to have an enormous amount of energy. And, of course, this looks frustrating when it becomes a symptom in the sense that it looks like hyperactivity. And my book provides some tips and some exercises for channeling that exuberance so that it can become a resource rather than a deficit. And then one of the other gifts of ADHD is interpersonal intuition. And if people who've had a lot of interaction with ADHD students have probably had this experience where it seems like they've got your number, in the sense that they can read you like a book. And sometimes when it looks like they're not paying attention and they're not listening to your words, it's because in some ways they're reading you on a different level. And so that has been a part of my experience. And then also emotional sensitivity is another gift. And in the young children, this often looks like temper tantrums and emotional outbursts. And there's another way of seeing that as an intense emotional sensitivity, and it's almost as if the volume on the world was turned up for these kids. And then a final gift of ADHD that I talk about in the book, and there are many more, but it's ecological consciousness. And when we think of a child with ADHD, we have this maybe sort of emblematic picture of them staring out the window in the classroom. Well, now again, if you ask them, why are you staring out the window, you might get some interesting answers. And when I have done that, I have found answers like, well, I was looking at the trees, or I saw a dog running across the street, or, it was raining outside and I was watching the rain bounce off the flowers. And usually it's a level of attunement to the natural world that is much more compelling to them than the abstract knowledge they're being asked to take in and regurgitate at some level that they're getting in the classroom. So it's this attunement to nature.
So do you think this increased stress on teaching to the test, and that teachers feel great pressure to have their students pass certain tests rather than the more broad knowledge we grew up with, would have an impact on this?
It certainly would. And I think that direction, this teaching to the test, this assessment-based interventions where we're putting our resources into testing rather than increasing our resources in other ways, is the wrong direction for children with ADHD. It may be different for other children who operate more in line with the standard traditional system, because for children with ADHD, they actually don't learn through abstraction. They learn through engagement with the real world. They learn through what I call project-based learning. Then I have found as a teacher that children with this diagnosis actually are superior to even a straight A student at sort of solving real-world problems. So it's the difference of saying, instead of saying what are the three different structures of the government and, asking for some facts and information about that, saying, well, here's an example of wasteful government spending. What would you do, or how can the government help to eliminate this problem? And you'll find that in this sort of a context, real-world applications, they really tend to excel in my experience.
And that type of thinking would certainly pay off later in life, and in the most desirable jobs require that type of thinking rather than regurgitation of facts.
I think that's exactly right. And, Bill Gates has said that our current educational system is obsolete. And I think it's probably true in general, but for children with ADHD, it's maybe even more true, because their method of learning and their particular gifts not only are not appreciated, but can actually be squelched in some ways. And because we live in a digital age, the demands are different. And, as anyone in the real world and in a job knows, you want someone who can solve problems. You don't want someone who can sort of list to you a bunch of facts and figures.
But I'd like to touch on your statement about the exuberance as being a gift. It seems to me that we're cutting back in schools. The first thing they're getting rid of is the PE or the time outside, either because of budget cutbacks or because they need more time to teach to the task. And it seems ironic because obesity is the huge problem for kids now, not exuberance per se. So do you think the fact that kids who need that physical release are being restricted even more could also influence the greater number of kids with ADHD?
I think that's right, that if you don't have an outlet for this energy or exuberance, it can turn into what it looks like hyperactivity, where it seems like they're bouncing off the walls almost literally, because they need that. And I talk about in the book that one of the worst things you can do for a child with ADHD, and it's probably true for any child, is to take away the recess as a punishment, because that is actually very healing for them, and it reduces symptoms. And so you're really starting to escalate a cycle, a vicious cycle, where some of these problems, you use interventions that make them worse. So yes, I think that's a terrible mistake, to take away the PE and the outside exercise and all of that. Yes.
I know there's a lot of controversy over ADHD. Why do you think there's been such a sharp increase in the number of children diagnosed? And do you think that the fact that the media is now doing commercials on regular television for every kind of drug imaginable has some type of effect on this?
Oh, I'm sure that it does. I can hardly open any parenting magazine these days without seeing an advertisement for these medications for ADHD. And I think that this aggressive marketing by pharmaceutical companies directly to parents is in part responsible. Because as a parent, you're not really equipped to understand that all kids have some of these symptoms some of the time. And the difference between having a full-blown diagnosis and having some of the symptoms some of the time is not something a parent, could or should be able to know. And so I think also feeding into that is what I might call hyper-parenting. And we live in a culture with intense performance demands, as we already talked about from an early age, not only for our children, but parents feel it among themselves. Let's just call it competitiveness. And if there's something out there that a magazine is telling you is going to help your kid do better with their homework, it's, as a parent, you think, well, I have to follow through on this. Maybe I'm even being neglectful if there's something out there that can help my child and I'm not, connecting to it. So I think it's a combination of hyper-parenting, direct, aggressive marketing, and also it just seems that with this high levels of performance demands, there is this increased emphasis on control, compliance, and conformity. And the more that we value those, then the more, it looks like a person's functioning is impaired if they're not able to, conform, for example. And, in my book, I also help parents to try to reframe what we might call defiance as self-reliance, which might be a sort of another positive reframe of children who are not complying as much as we would like.
Yes, I think that's important to get out, is that you're a mother of young children yourself and certainly understand the demands and stress among parents today. And I think all of our hearts go out to just how difficult it can be, and that we all love our children and we understand everyone is doing the very best they know how to do.
That's right. And I find I have to sort of pull myself back, 3 or 4 times a day, it seems, whether it's something I heard on the media or something another mother said or something, and just say to myself, that this is not a competition. It's just not. And I think, another, maybe my own personal mantra and something that is reflected in the book is find the strengths and focus on the strengths. I find that in a competitive atmosphere, parents will focus on what their children are not doing. And there's this emphasis on repairing weaknesses rather than celebrating, amplifying strengths. And so that's something that I use with myself.
So what do you think are some of the problems that can arise from labeling a child with ADHD, and how do you suggest that parents cope with them?
Well, I do have concerns. When I have directly spoken with adolescents who have been given this diagnosis, they talk directly about low motivation, low self-esteem, low self-efficacy that results. So, for example, if you get this label, you may think to yourself, why should I try?
Oh, my goodness, yes.
It conveys that you're handicapped in some ways, that you are not on the same playing field as everyone else. And so that can lead to this low motivation. And the thing that we know about academic performance is that, in the majority, it's determined by persistence, motivation, and personality factors. And it's being undermined by the diagnosis itself. And then I just think because it has this very technical, medical-sounding name, it also conveys that you're not in control of your symptoms. So again, it's not too hard to hear children saying, oh, my ADHD made me do it. And that very same, kind of explanation, again leads to this idea of, well, I don't have to control myself, my ADHD made me do it. And then also low self-esteem, that if there's something really wrong with me, then we tend to not even be able to trust our own self. And, a lot of people would say that that's really one of the foundations for, leading a healthy, happy life is feeling fairly good about who you are.
Well, Well, to play devil's advocate here, a lot of people might argue that you have a very Pollyannish way of looking at ADHD, and how would you answer them?
Well, Pollyanna, if I remember the story, actually transformed the very people who her very positive ideas were a reflection of, and that those ideas become self-fulfilling prophecies. And in fact, that idea is not Pollyannish. That is supported by an enormous amount of research, which has shown that, for example, teachers' expectations of children become self-fulfilling prophecies. If you split up a classroom and tell the teacher that these students are gifted, those students, whether they are or not, will do better by the end of the year.
Very good point. So would your opinion be if a student suddenly transferred into a new school where they weren't known, and when there were records from the old school has somewhere in that form, I assume, the student has been labeled as an ADHD student, do you think that would have an impact right at the very beginning on possibly what type of classrooms they put the child in, or how they perceive the child, or the type of gifted programs they may or may not offer?
I do believe that that is a powerful label that does affect many expectations and decisions about where they will go, and at an even more subtle level, teachers may sort of prepare themselves for this difficult child. And because these are very emotionally sensitive children, I think that's one of their gifts, they're usually very attuned to the way they're being perceived. And I think children will live up to our expectations, and sadly, I think they'll live down to our expectations also.
So is it a correct assumption that if a child has been officially diagnosed with this, that will be in their school records and will follow them throughout their school career?
Well, I think that can be the case, and that sort of does lead into another switch I ask parents to make that I think is key in having this transformation of problems into strengths, and that's that parents become an advocate for their children. And usually it can be at the level of what you're saying, going in there and asking that it be taken off, that it be removed, or it could be, yes, this diagnosis has been given, but here are the strengths of my children. I'd like these to be focused on and emphasized. I'd like you to understand that my child learns in a different way. So parents can go into the classroom, into the systems, and become advocates for their children to change those perceptions.
I think that's excellent advice. And getting down to the nitty-gritty of the parent who says, well, you've made a lot of really good points, but I'm the one who has to live with this child, and they have some behaviors such as short attention spans and emotional outbursts. I can't take them to the grocery store. They act up so bad. What do you suggest I can do to make my life easier and better for my child? Well,
remember, it's not that your child's not paying attention. They're always paying attention to something. And what we know is that people pay attention to what is important to them. So the most important thing you can do is find out what is important to your child, what are they paying attention to, and use that to develop or build the mental muscles they'll need in this, in a more standardized curriculum. One example I've used is a child who was obsessed with Lance Armstrong, for example. Helping a parent could use that and say, for example, well, what would have happened if Lance Armstrong would have said, why try? And sort of taking what they're interested and using it to build motivation, increase persistence by sort of whether like an inspirational example like that. And as an aside, I think it could help parents to know that, for example, Lance Armstrong's mother said that he could have been the poster child for ADHD. And now look at what he's, done with himself. I think that kids pay attention to what they, at some level, know is important to who they are and what they will become. And so for parents to validate whatever it is that the child is intensely interested in, and then also using that to help with these other areas. And then with what you said with emotional outbursts, in addition to whatever interventions you're using, such as timeout, I really want parents to get comfortable with what I call emotional reflections. So if your child is having a temper tantrum, that you can say, whatever, you're mad, you're angry. And this is a long-term investment. This isn't something that's going to turn the behavior around right away, and that's why you might want to use it in addition to the other techniques that you're using that you can read about in any parenting magazine or any self-help thing about timeouts or reinforcing the positive. Those are all important. But in terms of the long-term maturity, they need to feel that their emotions are okay and that you understand those emotions. It's the behavior you want to change, but you also want them to be connected to their emotions and to understand them. More and more we know that emotional intelligence is more important in determining a child's success than actually standard intelligence. So, and if a child is, fussing, pulling, pushing at a sister or brother, saying, I understand you're jealous of attention. And so using these reflections, or if a child, has a hard time going to daycare, oh, I know that you're sad, sad. And all of these things help a child to manage their emotional world, which is when they cannot contain them, which actually developmentally, they really can't. I mean, that's predictable. But that the more they understand and can label and feel their emotions, the less you're going to have a behavioral disturbance.
Oh, I think that's great advice for parents of every child, to give them that help to build their emotional intelligence that way. Well, if you could, in an ideal world, if you could describe the ideal learning environment for children with ADHD, what would it be?
Well, I think, first of all, would be an emphasis on project-based learning over abstract, and I call it regurgitation. What I mean by that is, here's some facts, I want you to memorize them and kind of give them back to me. Children with ADHD do much better with real-life problems. Also, related to that is sensory learning. They need to kind of have hands-on. So instead of just saying, here's a worksheet, fill out the anatomy of a leaf, asking them to go out into nature, bring back some leaves, show me the different parts of it. So really, really getting your hands involved. Also, real-life problems. And, a simple thing is just admitting the need for physical activity. I mean, the younger a child, it's just a part of being a kid. You need to have activity. You need to move around, and there are different ways education systems can accommodate that. And then for children with ADHD, it might be individualized lessons. And this seems like an impossible thing to ask with 30 kids and one teacher and limited resources. But there are now, increasing technologies, whether it be computers or internet applications or software applications, that can help a teacher to let children proceed at their own pace, to study a same topic using, an area of intense interest. So with some creativity, these are the sorts of things I'd like to see.
And it sounds like a lot of those ideas could also be applied to home. The parents could try to turn off the TV and get their child, take them to the park or get them out into nature, allow them the physical activity like you mentioned. If they have a computer, they could get computer programs where the child can learn at their own pace and label the child's emotions like you mentioned. So I think all of these things would have a tremendous impact and also make their family life a lot happier.
I think that's right. And so I do think, my main message is one of hopefulness. That sometimes small changes can make big differences, and rather than setting up a vicious cycle, you can turn it around and set up what I call a synergistic cycle where things start kind of having a cascade effect in a positive direction. So I'm very hopeful that even parents who feel that they're at the end of the rope, they're frustrated with their child, some days they may feel like they're bad parents, that it can be turned around, and that sometimes just a simple intervention can make a big difference.
Well, that's encouraging advice. Thank you so much. Are there any topics or questions I have not covered that you would like to address?
I think I just would like to say that the main principles of transforming a child's problems into strengths is for parents to realize that, first of all, their close connection to their child will transform him. It's certainly understandable that parents get frustrated, that they get angry, that they feel hopeless, but your child needs to feel that you are on their side and that you are connected to them, and that will transform behavior in itself. But also that your positive perceptions of your child search for the strengths, find the strengths, and focus on those. And that will increase your child's motivation to work in the areas that do not come as easily to them. It will encourage your child to maintain persistence. And really, those things can, again, turn around a lot of apparent problems.
Yeah, I'd just like also to add, as the parent of grown children, is take time to just enjoy them, because even though some days seem to go on forever, I can remember that well, it just goes so quickly.
Yeah.
So really enjoy the experience.
Oh, that's wonderful advice.
So thank you so much for being our guest. Could you please give us your website URL and any contact information you would like to share?
My website is www.visionarysoul.com, and you can reach me at lara@visionarysoul.com also.
And listeners could purchase the Gift of ADHD, How to Transform Your Child's Problems into Strengths, off your website?
That's right. There's a link right to Amazon.com
Wonderful.
from there. Yes.
Well, thank you so much for being our guest.
Okay. Thank you, Deborah.